Hi beautiful people, and welcome back to my channel. If you're new here, welcome. My name is Anava and I make faith related and medical related videos. In today's video, I'm going to be talking about my experience in urology and giving you guys tips that you can use as you enter the department for rotation or clinical internship. Without wasting much more time, let's get straight into today's video. So before I even start this video, I just have to make a public service announcement that I am in love with urology. Like, I didn't think I would love it this much, but I am so in love with urology. If you have watched any of my previous videos with my experiences in the hospital, I'm going to leave the link for the playlist up here. You will know that I always say internal medicine is my baby and internal medicine is my passion, but I think internal medicine has officially gotten a run for its money. Right now it's like a tie. I don't know who's going to win. I don't know which one I'm going to do, but then urology has really stolen my heart. In the hospital that I was working at, urology was supposed to be done for 1 month only, but because there was a shortage of doctors in the department and we were unable to really rotate and move, that was when the COVID pandemic just started, if I'm not mistaken. I spent 3 months in urology, 2.5 months to be specific, and I am so happy that I did, because I learned that I actually really like the department and I love the atmosphere, I love the people. Urology is just a really good place to be. It's really nice, like I can't lie, it's really nice. So like I said, my goal for so long was to do internal medicine, and I never did announce this, but one of the subspecialties that I really loved was nephrology, which is just the science of the kidney, and I did want to be a nephrologist. So I think maybe that's why I related to urology so much, because of its relation to nephrology. It's like the same system, the urinary system, which includes the kidneys, and so maybe that's why I had such a huge passion for urology. But then I'm going to start off by saying this: the atmosphere in the urology department in the hospital that I was working is awesome. Like, I always hear about the stereotypes of urologists and their personality stereotypes. They're all chilled and they're all laid back. That is very true. That is very true, and it was very evident in the department that I was in. One of the things that really drew me to fall in love was the atmosphere that was created by the people that were working there, the registrars, the consultant. It was just a very lovely atmosphere, very happy, very relaxed, very chilled. No pressure, but everyone is still hardworking. Everyone knows their position and everyone does their position. It's just a very nice atmosphere. Another thing in urology is that it has good patient numbers. In the whole surgical ward at the hospital that I was working at, we have general surgery patients, we have ortho patients, we have urology patients, and we have dentistry patients. In the whole ward, besides dentistry, of course, urology had the least number of patients all the time. And so the patient number is good, the patient outcome is good, the reward of treating a patient was really, it was good. I love the outcome of the patients. Another thing that I will point out working in OPD and having to admit patients into the ward is that there are not a lot of urology emergencies. I mean, there is your urinary retention, there is your paraphimosis, there are those emergencies that you'd want to see acutely, but then majority of the time, most of the emergencies that I would receive in OPD, the surgical department, were going to be either fractures from trauma such as road accidents or falling from heights or something that were going to ortho, or the same thing, RTA is going to general surgery, or intestinal obstruction, appendicitis and the like. It was very rare that you'd get a urology emergency, which is good in my opinion. The last thing that I really loved about urology is that it is a perfect blend of the medical aspect and the surgical aspect. If you've ever worked in a hospital, I'm sure you have heard the jokes that go back and forth between the physicians and the surgeons, and it's very rare that you'll find something that crosses over and blends both very well. It's either internal medicine and pediatrics, or general surgery, ortho, but then you do have the few departments like obs and gynae, urology, that are like a perfect blend of the two, and that is what I loved about urology. It's such a perfect blend of the medical and the surgical aspect. Now let's move on to some cons that I experienced in the department. One of the biggest cons of urology is Fournier's gangrene. If you don't know what Fournier's gangrene is, just pause this video and go Google what Fournier's gangrene is, and don't go to images because you're going to be traumatized. Just Just Google and read what it is, but it is horrible. Like having to treat that infection, oh, it's really, really horrible. And then most of the patients go for surgical debridement and shameful exposure, and then like the wounds that remain there. If you watch my general surgery video, you know that I complained about wounds, and that is my issue with urology as well. One of the cons is that it still has wounds, which I don't like bad wounds to be specific, infected wounds to be specific. I don't like cleaning them. I don't like looking after them. And so having to treat Fournier's gangrene, especially after there's a need for surgical debridement and having to treat and look after that patient, it's not my favorite thing to do. Another con in urology is that you're going to be dealing with a lot of elderly people with cancer, because of course prostate cancer is something that is very common. If cancer is not something that you would want to see a lot of the rest of your life, then urology is definitely not for you. But yeah, that is another con. Just having to break the news to people, just having to see people maneuver and try and understand and accept the diagnosis of cancer in their life. Maybe go for radiotherapy, go for chemotherapy, maybe go for operative management. The next point can be looked at as a con or a pro depending on what your preference is, but that is majority of the patients that you're going to be working with are going to be male. There are some female cases that a urologist is going to see. Anything that has to do with the urinary system specifically in a female is going to be seen by a urologist, and if it's to do with the reproductive system in a female, it will be in gynecology. But under urology, you see both the reproductive and the urinary system of a male, and so majority of the patients that you're going to be dealing with are going to be male of various ages. There's going to be little children that are coming in for circumcision, that are coming in for phimosis, and there's going to be elderly men that are coming in for BPH, that are coming in for Fournier's gangrene, like I said. So majority of the patients that are going to see are going to be male. Now this can be a con in the sense of sometimes, especially for the elderly males, they don't give you the same respect that they would give a male doctor, because till this day there are some people who think if you're a female in the hospital then automatically you're a nurse. So that is a con depending on how you look at it. Another thing is that male patients generally, not just in urology but generally in surgery, in internal medicine, male patients tend to arrive at the hospital more sicker than female patients, because if a woman is feeling ill, she's going to want to check it out, but a male usually delays. This is not all males, but majority of the males are going to delay until they get to a point where they are forced to seek help and come to the hospital. And so generally what we see in the hospital is that male patients arrive sicker than female patients, and because urology is mostly male patients, you are going to see this reflected in that majority of the patients that you see are going to arrive sicker. Or for example, prostate cancer, the example that I gave, they will arrive when it is more far along than when they first began to see the symptoms happening to them. So now here are 5 tips that I'm going to give you if you're about to start the department of urology. And the first thing that I'm going to talk about, just off the previous point that I mentioned, is that urology is about the urinary system of male and female and the reproductive system of a male. And so these are very intimate organs that you're going to be dealing with when it comes to people, and so you have to be respectful. Especially for me as a female having to do with males, I constantly have to remember to be respectful to my patients and keep a professional manner with my patients. And so that is just a general thing. Even when you go to obs and gynae, that is a general thing, because of the area that you are dealing with. You have to be very, very sensitive and very, very respectful to people when it comes to that. The second point I have is that you have to get comfortable talking about awkward things. You have to get comfortable talking about sexual partners, sexual function. If a man is able to perform well, you have to be comfortable talking about infertility and their inability to conceive, which when someone comes to see you, they may feel shame around it. So you have to get comfortable in a very respectful manner to talk about these specific things. Of course, that is not the only thing that you're going to be talking about. There are some easier topics, but then these are the more big topics that people are not really comfortable to open and share. But you, as their doctor, as a urologist, you have to get to a point where you're comfortable enough to ask someone such intimate questions in a very professional manner. The third point that I have is that you have to learn how to catheterize a patient. You have to learn how to do it the right way, especially if you're going to be in urology, because the urologists are so strict on that. They're very particular with how you're supposed to catheterize a person. So you have to learn how to do it the right way, in both male and female, especially male, but also in female. Catheterizing someone the wrong way may result in trauma, and the person may end up with a urethral stricture, which is something that we do not want. So you have to learn how to do it the right way. When you catheterize a male, you have to push the catheter all the way until the purification before you inflate the balloon. If you have catheterized before, or if you're familiar with the catheter, you'll know what I'm talking about. But just learn how to catheterize patients the right way. The fourth tip that I have is that you have to know how to do a DRE. A DRE is a digital rectal examination, and that is when you literally insert a finger in someone's anus in order for you to feel the prostate, because the prostate is just below the rectum. And so majority of the time, if the prostate is enlarged, if it's irregular, if it's got bumps, it's got nodules, you'll be able to feel it from the anus. And so you have to know how to do a DRE. You have to know what the prostate feels like in a normal male, and you have to know what the prostate feels like when it's enlarged. You have to be able to differentiate with whether it is just firm, or it is actually hard, or it is nodular. You have to be able to differentiate between all that through the DRE. The last tip I have is that you have to learn your anatomy. Just like any other surgical specialty, anatomy is very, very important. You have to know the anatomy of what is going on. You have to know which organ is where. You have to know where the prostate is, where the seminal vesicle is. You have to know where the kidneys lie. It's really, really important, especially if you're going to be in surgery. Of course, it's really important to know what lies where. So yeah, that is my last tip. Alright people, that is the end of the video. I hope you did enjoy it. If you did, please go ahead and give it a thumbs up. Subscribe to my channel for more medical related videos. If you would like to see my other videos about my experiences in the different departments, please check the description down below. I'm going to leave links for the previous videos that I have already done. Thank you so much for watching this video. Bye.